The patient's case took place on the 30th of November 2020. The location is Sao Paulo, Brazil. The gender of the patient is female, and the age is 76 years old. Her first symptom is that she's feeling unwell. Her second symptom includes pain and burning sensation on the chest skin. Her third symptom is a vesicular papular rash in small strips on her back, chest, and her left side of the neck, accompanied by pain and itching at the rash site. A fourth symptom is a heavy and dry cough, and the fifth symptom is a loss of taste and smell.
As can be concluded from the patient's signs and symptoms as well as travel history, the diagnosis that our group has decided on is shingles. Shingles is caused by the varicella zoster virus, which resides inactively in the nerve tissue located near the spinal cord and the brain, and this can be reactivated as shingles. Here are the following symptoms of shingles, which include blisters, fever, breathing difficulties, tingling numbness and shooting pain, nausea or vomiting, as well as stomach pain and diarrhea. The patient's symptoms which are significant to that of shingles can be explained by the mechanism of this shingles virus, and each symptom will be explained in the following slides. The first symptom the patient has is the vesiculopapular rash, which is associated with the inflammation of nerves beneath the skin. The rash is a distinctive cluster of blisters filled with fluid and normally appears in areas such as the side of the waist, one side of the forehead, or around the eye, but can typically appear anywhere around the body. Moving on, the patient also has a burning or stabbing sensation involving the chest wall. This can be explained by the pathophysiology of the varicella zoster virus, which causes shingles as it affects the nerves in the chest wall and causes that pain. Other sensations also include itching or numbness and can affect other areas such as the face or back. The next symptom of our patient that can be explained by the diagnosis of shingles is her heavy and dry cough, which are caused by internal shingles due to neuronal damage of the virus. This results in irritable nociceptors as well as afferentation. When the vagus nerves are affected, a chronic cough occurs. This symptom might also be caused by varicella zoster virus-induced pneumonia, which is linked to the next symptom, difficulty breathing. This is because shingles can cause inflammation in the lungs when it affects other organs. This can lead to pneumonia as well. Moving on, the loss and taste of smell experienced by the patient can also be explained by shingles due to the development of rash near the mouth or the nose. As stressed several times, shingles causes nerve damage and this affects the oral sensory, therefore causing a loss of taste and smell. Therefore, it is concluded that the patient's symptoms match those of shingles. However, other questions that we could ask to better understand the patient's condition can further confirm our diagnosis. The first question is if she has any other uncommon symptoms of shingles, which include chills or loss in muscle mass. The next question would be to ask if the patient has had chickenpox before, as shingles develop from a chickenpox infection. Lastly, we would ask if the patient has been ingesting any medications that might increase her risk of getting shingles.
Shingles may produce on skin due to the weakened immune system. If the immune system is weakened, for instance, as a result of cold, extreme stress, or old age, the virus may multiply again and move along the affected nerve, eventually reaching the skin. When the virus multiply in skin cells, they cause inflammation and typical shingles rash. Moreover, those who had previously chickenpox or who had varicella vaccine can develop shingles. As shown in the picture, the chickenpox caused by the virus during childhood will move to the dorsal root ganglion, where it will remain latent indefinitely. After years later, due to weakened immune system, depression or stress can trigger reactivation of the virus and causing shingles. As there's increased stress levels might have an impact on immune system, since stress affects the immune system, many researchers believe that stress could be a trigger for shingles. People over the age of 60 are at the most risk of developing shingles. This is primarily because aging takes a toll on an individual's immune system, which makes it harder for them to fight off infection. Complications from shingles in elderly can lead to serious long-term health problems. Pathogenesis of shingles. Varicella pathogenesis infection of varicella zoster virus is initiated through inhalation and exposure of mucous membranes of respiratory tract to the virus. Initially, replication occurs in the vaginal lymph nodes, followed by a cell-associated virema, during which the virus infects the peripheral blood monocyte cell. Viral release from the reticuloendothelial cell initiates by second phase of cell-associated virema, spreading varicella zoster virus to the skin. During the resolution of varicella zosters establish latency in the trigeminal and dorsal root ganglia. Herpes zoster and PHN pathogenesis Varicella zoster virus reactivation initiates the development of HS. There are 4 risk factors in total for the shingle disease, such as age. A person prone to have the shingles at an age onset of 50 years old, and the risk increases with age. Moreover, the medication and the procedures such as chemotherapy, radiation therapy, medication that is designed to prevent the rejection of transplant organ, and prolonged use of steroid could potentially lower the resistance of one to shingles. Followed by the health condition of a person. A person having disease that weaken the immune system, such as HIV and AIDS, history of the childhood cancer, current cancers such as Hodgkin lymphoma and diabetes may increase the risk of one person getting shingles. Finally, the study has been shown that black people are at a lower risk when compared to white people. Let's discuss the tests that are able to diagnose the shingles. However, physical examination will be carried out before the step where the tissue scraping or blister from patient or saliva swab has been taken for examination in the laboratory. The patient will be questioned whether he or she has had chickenpox or received the chickenpox vaccine before. This is because the virus that causes shingles and chickenpox is the same, which is the varicella zoster virus, in short, VZV. After a person recovers from the chickenpox, the inactivated virus may react later, which will lead to shingles. The following slide has shown the difference between the chickenpox and the shingles. Firstly, the PCR test can be used to detect the DNA of VZV that cause shingles. Other than PCR tests, direct fluorescent antibody or Zinc smear testing is used to diagnose the shingles as well, although both of the tests are less sensitive than PCR tests. Secondly, serological method that can be applied when a person has atypical rash or a sample or swab are not suitable for PCR testing. Serological tests can detect IgM and IgG antibody that are produced after a person is exposed to VZV. The following table has shown the difference between the IgM and IgG antibody, where they both have a different period of emergence in the human body after being diagnosed with shingles. IgM antibody will diminish gradually but will reappear during a shingles episode, while the IgM antibody will remain in the body. The presence of the different antibody may indicate the different stages of infection shingles. Anyhow, the presence of both IgM and IgG can indicate that the patient has diagnosed with shingles.
The treatment of shingles and herpes zoster include 3 aspects, which is treating the acute viral infection, the treatment of the pain and associated symptoms of the infection, and prevention of post-herpetic neuralgia. For the topical treatment, calamine lotion, which is zinc oxide at 0.5% iron 3 oxide, is used to prevent irritation from itching. It is also used for weeping blisters, applied twice a day, daily. Aciclovir 5% cream and capsaicin is used to treat the rash caused by herpes zoster, and capsaicin is used to desensitize neurotransmitters in the nerve endings. Aciclovir to be applied 5 times topically daily for 10 days. Antiviral medication. Aciclovir, valaciclovir, and famciclovir can be administered orally to treat shingles and is only effective if administered within 3 days of the vesicopapular rash. Therefore, in the patient's case, administering aciclovir is not recommended. This is because, if administered after 3 days, it is not effective. Prednisone is used along with aciclovir to lessen pain, and dosage for aciclovir is 800 mg 5 times daily for 10 days or 10 mg per kg IV every 8 hours for 7 to 10 days if it is administered through an IV. For the patient's heavy and dry cough, Robitussin maximum strength is prescribed. Syrup contains acetaminophen, dextromethorphan, guaifenesin, and phenylephrine. This medication is a cough suppressant most suited for dry cough to suppress the cough reflex. The dosage is 20 ml every 4 hours. Post-herpetic neuralgia can be treated once formed using the following: neuroactive agents, anticonvulsant agents, narcotic and non-narcotic analgesics, both systemic, for example opioids. Topical capsaicin and lidocaine is used, although not a first response. Topical capsaicin is extracted from chilies. The prevention of shingles include Zostavax, which is a vaccine for 50 years old and above, Shingrix, a vaccine for 50 years and above, and chickenpox. The chickenpox vaccine is used to prevent chickenpox, which is useful to prevent shingles. Summary: the first 72 hours are crucial to treating shingles with aciclovir. Diagnostics: a serological test is best followed by PCR for convenience. For the vaccine, Shingrix and Zostavax for over 50 years old. And to prevent post-herpetic neuralgia, an efficient treatment of acute shingles is to be done. The conclusion: the final analysis is that the patient has been diagnosed with acute shingles. This conclusion was finalized by the patient's vesicopapular rash and a burning sensation on the skin. The diagnosis can be finalized with a serological test and, if unavailable, a PCR test. The treatment for the patient includes topical aciclovir applied 5 times a day daily for 10 days, and calamine to be applied to relieve itching twice daily for 10 days or until rash itching subsides.